What's up, guys? My name's Odin. For those of you that didn't tune into my last video, I'm from Northern California. I'm here to tell a second part of my story to how I contracted COVID-19 and ended up on the ventilator and in a coma. In my last video, I kind of touched on the subject of what led to me getting sick and how I ended up at UC Davis Medical Center in Sacramento. Again, I contracted COVID in late October, and it didn't take me but a couple of weeks to be in really bad shape, and 3 weeks to be on the ventilator. Which, if you can tell, my last video I had the nasal cannula on. The doctors told me that I can start the process of getting off oxygen, which is huge for my situation. In the beginning, before I got out of my coma, they told my family and my wife that I needed a double lung transplant to be able to even live, to even have a chance to live. I had 3% of my lungs. They could barely show my family a healthy piece of tissue in my lungs. So again, I want to touch on the subject of going under, being on the ventilator, and being in a coma. So when they put you on the ventilator, again, like I explained in the last video, they make you sign this waiver that is basically giving them permission to resuscitate you in the case that your body just it shuts down on the ventilator. Some people, if they're older, a lot of people have a do not resuscitate because they just, they're at an age where, they felt like they lived a good life and God's, taking them into his bosom. And I could tell you that going into this, that I was completely terrified. Like I said in my past video, having to say goodbye to my kids and my family on an iPad, that was the hardest thing I've ever had to do in my life. So getting back to the ventilator, they put me under shortly after they started counting backwards from 10, got to about 5, everything went black. But then I fell into this kind of a realm. I wouldn't even call them dreams because, you are in a conscious state. People say, oh, there's no way he can hear you. There's no way that, he can respond to you. That's complete bullshit. If you have anybody in your family or a loved one that is on life support, please do not give up on them because they hear everything that you're saying. So when they put you on the ventilator, they have to put your body on a paralytic. So they put your body in a paralytic because basically you have to be completely paralyzed for the ventilator to work the way it's supposed to. They give you an endotracheal intubation, which basically means that's the tube that they put down your throat after they give you your sedation and your paralytic. At some point, I don't remember, but the first run of them trying to intubate me, I guess I pulled out my endotracheal tube. This, they told my family they've never really seen before. I don't know if it was just because I was fighting it. I don't know how, because I don't know how the hell I didn't have no energy to barely even stay alive at that point. But nevertheless, I did. I took the tube out of my throat, They had to restrain me. Um, Being on that paralytic is, you can feel it. You know when you start getting into that subconscious state that you're alive, and you know you're on that teetering realm between heaven, hell, whatever you want to call it. Again, I'm not here to preach to people. I can't stand it when people try to preach to me. That's not what I'm doing. I do believe in God. I do believe that, God is in your heart. You don't have to go to church to believe in God. Nevertheless, the state that I fell into, it was so real. I could hear everything. During the point of being in the ventilator on my coma, the ICU team would bring in the iPad so my kids and my wife could talk to me. They would play music for me. They were singing to me, you know what I mean? They were praying over me. All the above. So I knew I was every time that I would hear their voice, my heart rate would go through the roof. I was responding to them so much that the charge ICU nurse was telling Melissa, we need to figure out, a happy medium here, because we need his heart rate to be at a certain level, and every time that one of the girls get on the iPad or he's trying to respond to you, which is technically almost impossible. So it's kind of fucking crazy that, that even happened, In that coma, you can smell things, you can taste things, you can hear the staff being around you at all times. In the coma, especially with COVID, they have to flip you and what's called prone you, which is where they flip you on your stomach, and you have to lay flat on your stomach. This expands your lungs, helps you get better perfusion and gas exchange in your lungs, so you can have your SpO2 levels go up. So I can hear them, because I was a bigger guy. I was chunky, a lot of muscle too, and sometimes they would have hard times with me. I can hear them telling me, hey, be careful with his arms. They did kind of mess up both of my shoulders, flipping me around. It was completely surreal, because the feeling that you have that you can hear your kids and you can hear your loved ones talking to you, but you can't respond, it's like you're heading, it's a bad fucking dream. It's almost like a nightmare, but it's real, and just listening to the staff, talk, and they weren't holding nothing back. This guy's probably never getting off of here. God, he's in bad shape. At one point, this is trippy. So, at one point, both of my lungs collapsed, which is called a pneumothorax. One collapsed right after the other and started to give me what's called a tension pneumothorax, where the ambient air in your chest starts to push on your heart and give you a heart attack. And during this point, I can hear the doctors and the rapid response team. This kid ain't gonna make it. We gotta get the air out of his chest. They were racing to save my life, and I was already in the ICU. I was in as bad shape as a human being can possibly be. My ICU doctor told me the amount of trauma that I took with my lungs, especially in my body, was equivalent to being shot 4 or 5 times and living. So, every day that you're on the ventilator, they say is equal to a 10-mile marathon. It saves your life, but it's putting a ton of stress on your heart, your kidneys, your liver, you name it, your lungs. So the longer you stay on, the more residual effects and side effects you're going to have from being on the ventilator. I mean, you know, you don't get to shower. You know what I mean? And when you're in the shape that I was in, I had so much shit hooked up to me at one point. I had probably had 15 different bags on my IV stand. And in the ICU, you have to have 3 IVs in at the same time. You can't never have nothing less than 3 IVs in at all times. And my body was in such bad shape. They were having such a hard time finding any kind of veins. So they couldn't even bathe me. So, you know what I mean? It's, or brush your teeth. I took my teeth, my skin took a huge toll that I'm still struggling with a lot of things today. And it's hard, because I'm a real vain person, like a lot of you that do know me or don't know me. I'm one of those kind of guys that, I'm not really going to walk out of the house, without looking halfway decent. My mother will tell you that I used to be late for school all the time just to have fucking creases in my pants. So, I was just hooked up to too much stuff for them to be able to give me any kind of care as far as hygiene goes. So, again, I'm in this coma. I'm starting to see loved ones of mine. And this is really hard for me to talk because a lot of you that know my family, my brother Demas was murdered when I was 13. He was 18. And my brother Junior passed away not too long after him. So going into the intubation process before they put me under, that's all I could think about. Am I going to see my brothers? Am I going to see everybody that I love? Am I even going to make it back to my kids? You know what I'm saying? What are they going to do without me? And these are things that, of course, any fucking parent is going to dread. I think back of it now and it still just chokes me the fuck up, even thinking about it. You know what I mean? Excuse my language. But, I started seeing loved ones of mine. My brother Junior was young, vibrant, head full of beautiful hair. Demas looked the same as I remembered him, man. And I didn't know how to feel about it. I couldn't at that point distinguish whether I was dead or if I was still in a coma because I can hear my kids. And they were telling me, just listen, bro. Just listen. We're here for you. And they were. I believe that, I know 100% that I had a lot of angels with me because it's beyond medical explanation as to how I'm alive right now. I can have 13 doctors tell you the same shit. And they told me the same thing. They would walk in with my chart and say, oh, you're the miracle guy, huh? One doctor told me, you should go get a lotto ticket because that's how fucking lucky you are. So again, I'm starting to see people who I haven't seen since, I buried them. And this fucked with my head. Obviously it would with anybody. You know what I'm saying? And it got to the point to where I couldn't distinguish what was real, what wasn't real. I knew 100% that I can hear my babies praying to me, crying, Melissa begging God, please don't take me. You know, her telling me about, how my dad says he loves me, and, uh, you know, everybody's praying for me. I have a slew of people praying for me. I mean, you guys know, you guys were the ones that were praying for me. You know what I mean? Whole churches and shit. Even a friend of mine who is a Buddhist, he had a whole, I don't know what you call it, a whole group of monks praying for me. So I know 100% that this helped, you know what I mean? And the thing that really got me more than anything was once I started to have any kind of fear settle in, the devil showed right up, man. No bullshit. That shit is for real. That motherfucker showed up with a cold, dark, sickening feeling, got about a couple inches from my face, and asked me if I was ready to die. Excuse me. And all I could do was just look at him and start praying. Eventually he went away. There were so many different scenarios where I was just trying to follow the voices. I just wanted to see my kids. And not being able to, distinguish what direction, where to go. It's never ending, And whether people believe it or not, that's completely up to you. My suggestion to people are, if you are the same age as me or close to me, I would start seriously thinking about righting a lot of wrongs, getting rid of a lot of that fucked up weight that you hold, grudges and all that shit, because it's not worth it, and it was very unsettling, and it was a trip, like I said, when I had my tension pneumothorax, when my lungs just collapsed. I was in this dream state. Wouldn't even call it a dream state. It felt real as shit. I was completely underneath water, trapped underneath ice, trying to get out. I couldn't breathe. I couldn't get out from underneath the ice. And right about that time was the same time that my lungs collapsed and was pressing on my heart, giving me a heart attack. And thank God they plunged a tap into my chest to release the air so my lungs can reinflate. My diaphragm can start moving again with the ventilator on a good tidal wave. So this whole time, when I started to come out of my coma, this whole thing was so real. I couldn't even distinguish the fact if I was still in my coma, if I was dead, or if I was alive. So before I had went under, like I told you guys in the prior video, the first video I did, the priest came in, read me my last rites, and he handed me a rosary that he had blessed. And I have the rosary still with me. And not only that, the girls had some sent it, because obviously you can't have no visitors. The nurses will bring, certain things to you, especially when it's religious icons or anything like that. So I had about 3 or 4 different rosaries. 2 of them were like green. One was really pretty red. That was wood. That was the one that the priest gave me that he blessed before I went on the ventilator. And my eyes kind of cracked open. I didn't know this at the time. And I started kind of scanning around. And at this point, again, I still thought I was in my coma. But I looked over on the wall and I had seen the rosaries. And I was like, fucking, that looks familiar, man. I know that, But what was throwing me off was my nurse, Alex. He's Ukrainian. And he was speaking in Ukrainian, so I was like, there's no fucking way I'm alive. This is, I'm still in a coma, you know, and, but those rosaries, you know, I recognized them. That was the one thing that was kind of clicking in my brain. I think, you're alive, you know? And, he seen my eyes open, and obviously he rushed over to give me a rapid head to toe evaluation, you know, just checking to see if I'm responsive at all, which I was. At this point, I have a trach, so my vocal cords are completely severed. I have no voice. I am completely paralyzed. I'm on a full paralytic still. Uh, my body's gone through so much, and he's looking at me and he's asking me if I'm okay, and I don't even have the energy to shake my head, you know? So it took me about 4 or 5 hours to be able to even start trying to move my fingers, because that's the first thing that they start with. They tell you, okay, can you move pointer finger, can you move middle finger, ring finger, pinky finger, and thumb? And you start to try to work your hands. So I didn't know if I was really alive still. And the way of communication was with a fucking whiteboard. Little whiteboard with a dry eraser marker, or whatever you call them. My hands are shaking so bad that I can't even write. I'm getting so frustrated. I'm crying. I throw it away. I'm like, I can't do it. Took me a day to write down, am I alive? And Alex looked at me. He's like, yeah, man, you're alive. You know, you made it off the vent, man. You know what I'm saying? Congratulations. You know, you're one tough son of a bitch. But, you know, we're not out of the woods yet, man. You know, we got a lot going on right now. You know what I mean? The 16 different antibiotics that they ended up using on me just completely destroyed my kidneys, at the point where my whole body was just a balloon. My testicles were like a grapefruit. So embarrassing. But, you know, my feet were swollen. I just was retaining water. I wasn't producing any kind of urine. So they were really worried about that. You know, of course, I go from one extreme, I survived the event, for them to tell me that I'm probably going to pass away due to kidney failure. So at this point, I'm on an antibiotic that costs $25,000 a dose. Yes, not 2,500, $25,000 a dose. It was flown in from Minneapolis, Minnesota, along with my stem cells. So for those of you that don't know, I did get stem cell treatment. That was I know that between God and those stem cells, 100%, that's what saved my life. And, you know, you would have thought that they were bringing in the Holy Grail itself. You know, they overnighted it from Minneapolis to Sacramento. You know, and they gave me the stem cells before I went on the ventilator. And, you know, I know 100% that's, you know, like I said, between the prayers and God, that was the make it or break it point right there. Because I don't think that my body, there's no way in hell, you know, people who were half as bad as me, 99% of them perished. No joke. There's 10 per unit. I was in ICU Blue. There's 4 different ICUs in UC Davis. I think there was 22 of us on the floor, and 4 of us made it out. I happen to be one of the 4. So I'm all alone doing this. I'm completely terrified. Still, I want to see my family. Somebody. I want the soft touch of somebody, from my wife. I want to be able to hug my kids, and the way that they were talking, it was just like I didn't really have too much of a chance. And I don't know if you can tell in my neck right here, I got a pretty big divot of a scar where I had to go in and have a PICC line done. This was super shitty because at this point, even though I was off the ventilator, I couldn't lay past a 30-degree angle because I would literally start to drown. When you have a trach in your throat, it comes with a tube. Every 15 minutes, they have to push this tube into your lungs and drain all the fucking fluid that's seeping out from my pseudomonas, my double COVID pneumonia, the abscesses. Everything was just still continuously pouring fluid out. It was they could barely even keep up with it. That's how bad it was. And so the stem cells definitely played a huge part, and going into it, it was, of course, it was my luck. I mean, they're like, so, Mr. Powers, sorry, I get winded talking. They said, you got a 50% chance of even getting the real stem cells. You could get the real stem cells or you could get this placebo. This is the only issue. So, I was really, I already had like that. I didn't think for 1 second that I was going to live by any means. And scared to death because as soon as, 2 hours before I go on this ventilator, they tell me, Odin, we want to try this drug that has been used to treat COVID patients in severe cases like you, and it's had like a 15% success rate, which isn't very high, but in your case, don't you want anything that is going to help you survive? And of course, being in the state that I was in, completely terrified, haven't seen my family for over a month and a half, 2 months, 2 months. And I'm like, what is it? And he's telling me, remdesivir. So I don't know if a lot of you guys are familiar with remdesivir. A lot of people were telling me before I even went into UC Davis, don't let them give you fucking remdesivir. It's killing people. It does not work. It makes you worse. So, I'm sitting there thinking, bullshit, I'm almost a conspiracy theorist myself. I don't trust nobody. I'm Italian. I think everybody's out to get me. But sure enough, as soon as they gave me that remdesivir, I went fucking downhill. Quick. Not only did it not help me, it seemed to make matters way worse. So, coming off of the vent, you were technically on a ventilator until you get what's called decannulated, where they take the trach out of your throat. You're just not on life support. You're on the vent, the fucking machine, which is giving you your tidal rates, your respiration rates, and all of that. So they make you go through what's called CAP trials. And before you can even start any of that, you have to start practicing working your vocal cords. But you have to do it properly or you'll damage them for the rest of your life. And like I said, at this point, my vocal cords were completely severed. I didn't even have a voice. My means of communication was with a marker and a whiteboard, which took me 2 hours to even get out one word. If I could write it, I needed help with everything. So, again, you start a whole different process. This is when, the journey begins. This is when, you separate the men from the boys, because coming out of the coma. You're coming off the paralytic, which is going to last. They didn't even have me walking until March. They told me that I had to be cleared by physical therapy and occupational therapy before I could even start the discussion of discharge. So that was way later. Again, I'm going to post. I got a lot of new material. It's super hard for me to look at. I'm going to post on here. I'm having a hard time split screening and posting things while I'm talking because, of course, I'm on my phone. I will be posting after this a video of what I looked like, I'd say about a week and a half after I came out of my coma. And it's heartbreaking, Again, these people are pushing you in a good way, because the quicker that you start to move, the quicker your body starts to heal itself. At this point, I had an ostomy bag, not through my stomach, but they actually go right up your rectum with it's like a block, and that is like a rectal catheter for your stool. I had the catheter in my penis, like I said, 3 different IVs, 2 in my throat, NG feeding tube in my nose. So I was still in really shitty shape. But I'll tell you what, I ain't never in my life felt so good, besides when my kids were born, when they wheeled in that iPad and I seen Melissa and the girls. Yeah, it was like God touched me himself, and I was just like, holy shit, and they're crying, I'm crying, and I'm like, fuck, I made it, you know what I'm saying? And I'm like, I'm really alive, and Melissa's like, yeah, you're really alive, you did it, dude, you know what I'm saying? The girls were ecstatic, you know what I'm saying, trying to fit all 3 of their faces in that little fucking camera. And I just lit up. It was the spark that I needed, underneath my ass, for me to start to focus on if I'm gonna ever make it out of here. Because by far, I am not out of the woods. Again, they had to give me a PICC line because they explained to me, Odin, your kidneys are almost in complete failure. So we need to get a PICC line in you ASAP. We couldn't give you dialysis when you're on a ventilator. So this was one of the more painful experiences that I've ever had. Because this went straight into my carotid artery. I took a lot of beating through the process of being on the vent. If you could see my face, they didn't change the pads on my ventilator tube, on the endotracheal tube, and it left me a nice scar. I got scars on my back from the pigtail drainage tubes, PICC lines in my carotid artery, my face. Yeah, my body took a big ding. So they're explaining to me, so we need to start getting some kind of urine out of you. If not, we give it maybe a week before you pass away. So I'm fucking just terrified. I'm pissed. Jesus Christ, how are you going to let me go through what I just went through to come off that fucking ventilator, and now I'm going to die from kidney failure? You know what I'm saying? So, they put the PICC line in, which was just the biggest anxiety, panic-filled situation besides going under for the ventilator, because they told me, listen, Odin, we can't suction you. So again, like I was explaining to you a couple of minutes ago, when you have a trach And your lungs, the way that I was, they have to go down the trach with a suction tube and pull the fluid out, which goes to a canister that they keep. So I had to get suctioned every 15 minutes. Sometimes, some days, every 10. And I can't do it myself. A nurse has to come in. So basically my nurses were on point, on call all the time. So they're like, Odin, this is going to be tricky because you have to lay completely flat for like 25 minutes. And this is no joke. If you slip, move, resist a little bit, and nick the fucking carotid artery, you're going straight to emergency surgery, and your body can't handle emergency surgery right now. You will die 100%. And or you will bleed out because you're on blood thinners and whatnot. So I'm just like, Jesus Christ, you know what I'm saying? What am I gonna do? You know what I mean? So the undescribable feeling of laying flat and drowning, literally, for 25 minutes, just trying to keep your composure and not panic while they're shoving a gauge needle that is not your average hypodermic needle. It's steel braided that comes out to where they can connect it to the dialysis machine. So laying there, having them push that into your carotid artery, it was fucking excruciating painful. As soon as they tapped my carotid artery, I knew it because I felt the overwhelming feeling of a whole spray of blood go completely all over my shoulder. Mind you, it seems like the doctors that were doing the procedure were fucking 18, but they were super young. Young, like 2-3 younger Indian gentlemen that what I'm saying, they were good doctors. They reassured me that it was going to be okay. So got the procedure done. I ended up going back to the room where I'm getting ready for my first dialysis treatment. Here's the kicker for this. So this tells you my luck. So I get back up to my room. They're explaining to me this is the process of dialysis. It's going to clean your blood out, which in turn is going to help your kidneys start producing some kind of urine, hopefully. And, we can go from there. We'll see how this treatment works first. So I asked him, what is the, what's going to be in my fucking PICC line? We have, it's 2 big canisters of contrast. I said, well, hold on a minute. I said, you guys look at my chart. That's my only medical allergy that I have. I'm deathly allergic to contrast, which is what they give you in your CAT scan before you go into the CAT scan, so they could see, intricate details of lungs, fractures, and what have you. But I am deathly allergic to contrast. And they assured me, this is not the same kind of contrast that you would use in a CAT scan. So you have nothing to worry about. At this point, this was the first time that they allowed visitors for me. And I got to see Melissa. And it was the most beautiful thing, I'll get into that more as my videos go by. But they start the process of kicking the dialysis machine on. I started getting super hot. I'm like, man, I look over at Melissa and she's like, what's going on? I'm like, I don't know. I think something's wrong. I don't feel right. And I was redder than this part of my shirt in 2 seconds. She knew it because she's seen me go into anaphylaxis before from contrast. So she's yelling at the charge nurse, something's wrong. At this point, I'm going into full anaphylaxis. You know what I mean? Straight off of the ventilator. Thank God they had an airway already. I had a trach in. So if I didn't have this airway, Lord knows, I lost all bowel control. Went into a full-on panic attack. My heart rate went up to like 200. I was on the brink of a heart attack. So they were rushing to push fucking copious amounts of epinephrine into me to be able to counteract this allergy, this allergic reaction that I was having to the contrast in the dialysis machine. So, needless to say, I was almost just damn near ready to give up. I kind of felt like I wasn't really meant to live. I'm like, there's no fucking way that anybody on this earth has the luck that I do. The fact that I'm even in here, is, terrible. Again, I'm going to post some videos. It's super hard to look at. I get it. But nevertheless, this is my story, and I want you guys to see the severity of what my body has endured, all the way from my lungs, my liver, my kidneys, and my heart, which I do have to have heart surgery in September. The ventilator saved my life, but nevertheless, it did some significant damage to my left atrium. So I have to go in and get an ablation surgery done where they go up through my femoral artery in my leg, take out the damage in my heart, and burn out one of the nodes that are misfiring because I'm on amionadrone medication that controls your heart rhythm. Because without it, if I stood up to take a pee, my heart rate goes to 170. So I just want to thank you guys for tuning into my videos. So much support. I just, this in a way kind of helps me too. I'm not one for fucking, therapy and shit like that, because I just can't have someone sitting there and telling me how to think, what to do, when they have never been through something like I've been through. If you haven't been on life support, I really don't want to hear, your opinion on what I should be doing. You know what I'm saying? It's not that I'm not up for constructive criticism or anything like that. I just, having somebody that has never been through the things I've been through in life telling me what to do just does not sit with me right. So I'm going to post a short video of about 3 weeks after I got out of the coma, when I started to start the process of learning how to swallow again. And we're going to get into all of that. I'm going to get into the just the intricate details of learning how to walk again, learning how to talk again, learning how to eat again, trying to get my bowels to move. I got a lot of material for you guys. But I could tell you, from the bottom of my heart, thank you guys so much for all the support. And please, if you find in your heart, share this video. Give me a like, subscribe, something. Just, the support means the world to me. I'm not trying to light up the world. If some kind of good can come out of this terrible tragedy, so be it, So, again, hope you guys have a blessed night. And I will be making a video soon, and I'll see you guys later.